Good day and welcome to today's DPI COVID-19 update. Today is, of course, October 30, 2020, and we are here speaking as usual with Minister of Health, the Honorable Dr. Frank Anthony. Minister, welcome again. We are, of course, coming off one-day holiday, Yom Manabi, and given the situation in Region 1, as you have recently been addressing a number of times, can you give us an update on how things are going? We know that health officials from Georgetown went up there. A lot of local officials have, of course, joined with the ministry's health officials and are on the campaign doing sanitization. Give us an update on what is happening and what are the latest numbers and figures showing.
Well, thank you very much for having me once again on the program. As you know, we have been working in Region 1. We have had a lockdown now for more than a week. And right now we have 4 medical teams, 3 headed by doctors, 1 by medics, and they have been moving around to different parts of the community, helping with the sanitization, talking to residents, providing education to the residents and so forth as to what to do, to prevent COVID-19. I think that has been successful so far. As you know, there are about 900 residents living in Guyana. We have about 184 households. We have been able so far to reach about 124 of those households, and this exercise is continuing. So I think at this point we have met with most of the people living there, and those who have been in more I would say, isolated areas in the village, we'll be meeting them very shortly. As you can imagine, going house to house, it takes some time, and at each household, we would spend time there to talk to the people, do the sanitization, help with the education, and so forth. But these efforts have been bearing fruit because what the medical teams on the ground have noticed is that there are more people that are compliant with our instructions. We've seen more people doing social distancing, wearing masks, and so forth. So I think the exercise has been quite successful. At Guyana, we currently have 53 active cases, and as you would know, just a few days ago, we had about 61. We are also continuing to test people at Guyana. So far, we have tested about 200 of the residents who have displayed signs and symptoms of COVID. And of those that were tested, 53 of them right now are active cases. We would continue testing over the next couple of days, and we'll see if there are new cases that would emerge from this testing. In terms of the people who have tested positive, we have explained to them how to home isolate, and they've been doing that quite successfully. We have also been monitoring these patients because, as you know, people can move quickly from having mild to moderate symptoms to easily deteriorate and become more severe and critical. The team that is on the ground, the medical team that is on the ground, is constantly monitoring this, and if we detect that there are persons who are showing signs of such deterioration, then we have in place a mechanism to move those patients out to the hospital, and in some cases to bring them down to Georgetown Hospital. So this is an ongoing exercise, and we'll keep monitoring. We have noticed, however, that while we're working to bring the situation in Guyana under control, that we are also seeing a little spike in the neighboring area at Haimacabra. And that's an area that we are also paying some attention to because we don't want the number of active cases to get too high. So the team would be deployed as well to that area so we can put similar measures in place. We haven't gotten to the point where we'll be locking down the area, but certainly we're talking to the residents, starting similar exercise there, and hopefully we can bring the cases down. If it is that we're seeing an increase in cases, then we'll have to add some new measures in that area.
So, if I hear you correctly, Minister, the residents have responded positively to the lockdown measures and other guidelines that have been put in place, and we have medical teams along with regional officials on the ground. How about the resources? Meaning by that, medical supplies, equipment, transportation obviously is a big issue there because of the terrain and the distances to cover between locations. Is the ministry able to handle the situation at that level in terms of resources, physically?
In terms of resources, resources are provided to the medical team both by the regional administration and the central ministry. The regional administration would have provided all the things necessary for the logistics, whether it's transportation, fuel, and the other things that are necessary. And we have provided all the medication, PPEs, and so forth that they would require, test kits and things like that. So far, everything that has been requested has been given to the teams, and I haven't heard any complaints about anything relating to supplies. Once they make a request, we normally would send these things in, and I have said to all the interior regions that they should keep a suitably high threshold of stock in the region, so at no point should we run out of essential things that we need to respond to COVID. So I think they're complying with that, and whatever other assistance they would need, we will be willing to provide that.
And the lockdown has been in place for about a week or so.
Yeah.
Do you see it being extended?
I think as last week we had about 61 cases. We are now down to 53. So there have been a number of discharges because people would have met the criteria for discharge. And we will observe over the next week, because I think many of the cases that are currently active would meet the criteria for discharge once they don't display any deterioration. So let's see. We'll do an evaluation maybe in a week's time, and we'll be in a better position to determine whether it continues or not. And also we'll continue doing testing, and we will get a better picture of the epidemiological situation there and whether we will need to continue. So the medical team on the ground would help us to make those assessments, and depending on the findings that we are getting, then we'll decide whether to extend or to remove the lockdown.
Switching to Region 4, with, of course, its highest population by region in Guyana and population density. There is a plan to implement or to start a campaign of sending out mobile units. Can you just comment on that? And also, is this part of the measure to increase testing on a wider scale?
Yeah, we've had ups and downs with our testing, and in some cases people would willingly come forward to get a test if they believe they have been exposed. And in other cases, people have been reluctant to get tested. So what we are doing now is we are analyzing the areas where we have seen spikes in cases, and in those areas, if there are cases around the area, one would assume that maybe people can get exposed. And even if they're not exposed, it is to go to those specific areas, have more focus on the health education, talking to people more about how COVID is transmitted and so forth. And by doing that, helping to lift awareness and maybe better compliance with the measures that we're talking about. So we have decided that in Region 4, where we have noticed an increase in cases, places like Diamond, we have seen higher than usual cases. And therefore, we'll want to deploy our mobile medical teams to go to those areas and to add additional services to what is already being provided by the static healthcare facility. So these are going to complement what you have already in the community. They would be able to offer testing if people are desirous of getting testing. And of course, we'll do the health education, the distributing of leaflets, talking to people about mask compliance and so forth. So it's all in an effort to educate people, and if people want to do the tests, then the tests would be available for them to do so.
So is this likely to start this week, you think? And also, is it a case where even asymptomatic persons or persons who might have felt they were exposed should go and get tested in these areas?
Yes, it's open. And so if there are asymptomatic persons who believe they might have been in a situation of exposure, they can come to the facility to be tested. As you know, in Region 4, we've had 2 additional testing sites, one at Horstelling and one at Paradise. So those have been operational. But because we have noticed spikes in certain areas, that is why instead of waiting for people to passively come to Horstelling, we have decided to go to the people. So, hopefully we can, if people come forward, we can get a better assessment of whether there are more cases in that area that we have not detected because we were doing more or less a passive approach to it. Now we want to have a proactive approach to see whether or not we'll have increased case detection.
The end of the month is almost here. October 31st, of course, is just one day away, which means that the current guidelines for COVID-19 will expire. And obviously, new guidelines will be in place, which in fact will ought to come into effect on the 1st of November. Can you give us a preview of maybe any changes and perhaps reflect on how the guidelines for October have been? Were they effective? Do you think the measures will continue?
I think by and large people have been observing the guidelines, but we still have challenges when it comes to gatherings and people not complying with mask wearing. I think we have seen improvements, and with Operation COVID Curb, we have seen more people wearing masks, but we need to take that up to 90 to 100% because that's our safest way of preventing the infection. So we need to keep working on this, and we need everybody to be involved in complying with mask wearing. One of the more recent findings, or not so recent findings, is that in terms of transmission, when the disease first started, basically there are 3 ways that you can get transmission. One is through touching of surfaces and so forth, and that's why the sanitation approach was used. The literature is showing that perhaps that method of spread is not as pervasive as once thought, right? But what we have now found is that in terms of droplets, that continue to be one of the main ways of transmission. And now more and more evidence has come out to say that you can have transmission by aerosols. Aerosols meaning that these particles are really small and can remain suspended in air for a longer period of time. And so more and more evidence is emerging that transmission really occurs predominantly by droplets and aerosols. And that is why it's important for people to understand this, because with smaller, lighter particles, they travel further. So in some cases, the 6 feet distance that we sometimes talk about might not be adequate for people to protect themselves against these aerosols. So it is absolutely essential that people use masks. And in indoor environments, it's even more challenging because many of the studies that were done simulating indoor environments and aerosols would show that the aerosols remain suspended in the air for longer periods of time. And if you go into a room where somebody who was infected was there and sneezed and so forth, these tiny particles can remain in the air suspended, and you can get into the room, and if you're not protected with a mask, then you can get infected, right? So indoor environments, not wearing masks indoor can become problematic, and that is why we're insisting that people wear their masks in these indoor environments. People start thinking about the effects of not just droplets, but also aerosols. And that is why it is also very difficult in some instances, because I know we've had a number of complaints from bar owners and so forth that they would like to see the opening up of bars. But when you open up bars, people go there to drink. Most of these bars are in an indoor environment, and therefore when you're in an indoor environment, you don't know if someone is infected and asymptomatic, and they can be spewing aerosols that eventually can lead to spread of the disease. So we have to be very cautious. And right now, what we are seeing is that aerosols indeed are one of the main ways of spreading. So to protect ourselves, especially in the indoor environments, we have to maintain the mask wearing indoor as well. So I would urge people, if you're going to public buildings, you're going to shops and so forth, and these are indoor environments, even if you're working, if you're going to work, it does not mean that your work environment, if you have other people coming from other places being there, if you're serving clients, you also have to bear that in mind and make sure that you abide by these COVID rules constantly. I know it can be difficult for you to wear a mask every day, but this is what we need to do if we are going to protect ourselves. We need to make that sacrifice. We need to put on the mask because it's going to protect you and also your family, because if you are infected, you can take that infection home to your family. So if everybody comply, then we'll have a much safer environment. And I just want people to understand that.
Well, that's very pertinent, Minister, because as it comes into November, people start thinking Christmas, traditionally all over the world, those who celebrate Christmas in December. And the reality is people are going to be shopping more, they're going to want to be out more, there will be visitations of family and friends, obviously. And is it likely then to be a different holiday season, you think? And in closing, again, feel free to reiterate what advice you might want.
The responsible thing to do, not because we have a major holiday coming up, that means that suddenly COVID-19 has disappeared. It hasn't. The virus is still here, it is still circulating, it is around us, and therefore we have to maintain our guard. We have to wear our mask, we have to do all the things that we know by now what to do, and that is wear your mask, keep your distance, sanitize your hands, and so forth. All these things we have to do. So not because we have a major holiday coming up, that we disregard all of this information and proceed as if COVID-19 does not exist. If we do that, that's going to be highly irresponsible. So we still have some time to December when that major shopping season kicks in, and people can either start doing their shopping early so as to avoid the congestion. People can start, the shop owners can devise various means of maybe decongesting their shops and stores and so forth, so as to prevent a lot of people just coming in at one time, and you're in this high density area with too many people in the shops. So we can take sensible precautions, and we ought to do that, and we must continue to wear our masks despite be wanting to feel more relaxed because of the holidays. You can't do that, because if you do that, unfortunately, there would be people who would get sick. And unfortunately, some of those people would end up in the hospital. So to avoid all of that, let us take the precautions and make sure that we all stay safe and stay out of the hospital. So, I mean, it's very clear. We already know how this thing is transmitted. We know how to prevent it. And it is in our power to be able to prevent it. So let's do the right thing. And I would urge people to abide by the rules, and we'll all be safe.
Minister, thank you very much for your words of comfort and warning as well. And just for those who have just joined us, to remind them that you were listening to the DPI update for today, 30th of October 2020. Minister, thank you very much once again for providing today's update.
Thank you very much.